Question number 59. A 70-year-old woman present with a blood-stained vaginal discharge. Both the ectocervix and the vagina looks atrophic on speculum examination. Cervical cytology shows no evidence of malignant cells, although no endocervical cells were seen. Which one of the following is the most appropriate next step in management? So the options are vaginal swab for microscopy and culture, colposcopy, ultrasound assessment of endometrial thickness, hysteroscopy and dilatation and curettage, laparoscopy. So a 70-year-old woman with blood-stained vaginal discharge, both the ectocervix and the vagina looks atrophic on speculum examination. Cervical cytology shows no evidence of malignant cells, although no endocervical cells were seen. So the most appropriate next step in the performance of is the performance of hysteroscopy, dilatation, and curettage. This would define the presence of an endometrial lesion and would facilitate histological examination of any endometrium which is present. Although endometrial thickness assessment is now used to determine which patient should have a D&C performed, such as a postmenopausal woman found to have an endometrial thickness in excess of 4 mm. This assessment is more useful in younger postmenopausal women, and postmenopausal bleeding at the age of 70 years should be deemed due to a malignancy until proven otherwise. Vaginal swab for culture and colposcopy would not be appropriate, and laparoscopy would not be required unless the hysteroscopy and D&C were normal but the bleeding continued. Although a malignancy is less likely if the endometrial thickness is less than 4 mm, the risk is not excluded by such a finding. So the correct answer is hysteroscopy and dilatation and curettage. Question number 60. A farmer has come to see you about advice on hydrated disease. He has been told that the reason he developed a hydrated Echinococcus granulosus cyst in his liver was that his farm was contaminated and he needs to get rid of the infection. Which one of the following the best way to eradicate Echinococcus from his property? So options are vaccinate his sheep, vaccinate his dogs, deworm his sheep, deworm his dogs, replace the lucerne grass in the poddocks with alfalfa. So how to eradicate this Echinococcus from his property? He's asking about this. So this question requires knowledge of epidemiology and natural history of the human hydrated disease, which is due to infestation of humans as secondary host in the life cycle of the tapeworm parasite Echinococcus granulosus. The primary host for this tiny worm, which is only the size of a grain of wheat, is the carnovirus dog, in whose intestine the worm resides. Half of the size of the worm is taken up by its last segment, full of eggs which are passed in the dog's feces and contaminate the soil and grass and the dog's fur. An environment where dogs and the cattle or sheep are in close contact, the herbivore grazing on the grass ingests the eggs and becomes a secondary host. The egg passes in the secondary host to the small intestine or absorbed into portal circulation and pass to the liver, where a hydrated cyst forms. The cyst progressively enlarge and has a three components to its wall: an inner germinal layer forming a scolysis and brood capsules, and a daughter cyst and a Kinchus membranous layer secreted by the germinal layer, together forming the endocyst, plus a reactionary layer from the host tissues, the ectocytes. The cyst in the secondary host first and most in the liver, and afterward in the lungs, then into the systemic circulation. If the cattle or sheep, lungs or liver is eaten by the dog, the cycle completes itself with the formation of fresh intestinal worms from the brood capsules or scoliosis from the ingested cyst. Human infection occur by the fecal-oral route, usually in the childhood from an oral ingestion of eggs from the dog's fur via children's hands. Humans then develop hydatid cyst as a secondary host in the liver, lungs, and elsewhere, and human disease is seen in farming communities in countries such as Greece, Turkey, Argentina, and Australia. In hydatid infection in human, the liver cyst and the components of infestation represent a dreaded end of the to the worm's life cycle. Prevention of disease in a primary and secondary host requires breaking the cycle at several points: deworming cattle, dogs, and sheep dogs regularly, avoiding feeding cattle or sheep offal to the dogs, and attention to fecal oral hygiene in humans. So D is correct: deworming cattle, dogs, and sheep dogs regularly. By such means, incidence and prevalence of the disease has been very significantly reduced in developed countries such as Australia. New cases in humans are now more commonly seen in migrants from the countries where the disease persists. There is a large reservoir of primary infestation. In northern Arctic countries, the cycle can involve transmission with the Arctic fox and wolf as primary hosts, and elk, caribou, or reindeer as a secondary host. Another tapeworm species less commonly seen in Australia, Echinococcus multilocularis, can be responsible for more infiltrative multilocular cystic lesion in the liver and other organs. Eradication of the multilocular cyst is more difficult than in the case of the Echinococcus granulosus, where standard treatment to expose and incise the cyst with removal of all contained endocyst material. So this is the life cycle. You can see, we can make it close. So through this sheep, over contaminate the dog's fur and goes to the human secondary host as a child. This is Echinococcus granulosus, and then it comes to the humans as a secondary host, and the adults mostly in the liver. This liver cyst and daughter cyst, which are smaller. So the correct answer is D. Deworm his dogs.